So I'm back here at the office. Let's grab a CT scan from the emergency queue and see what can we report today. I have already downloaded the images. I'm just going to share my screen right there. So this is the Scout X-ray, and as you guys can see, this is a 51-year-old male patient who got himself involved in a car crash and was brought to the emergency. As the clinical history says, he has been already evaluated by the surgical team that said he has no signs of closed abdominal trauma, so this isn't a CT scan of the abdomen for trauma. This is from some sort of abdominal pain this patient is complaining about, but none related to the trauma itself. Nonetheless, this is a trauma patient. This exam has been done, was scanned without contrast enhancement, which is a bad sign. And as you guys see right here, the patient is very mal positioned. There are some metallic objects right here. His arms are down by the side of his left thigh, and he has a hand with a metallic fixture of some sort over his pelvis on the right. This is going to be very bad, but it is what it is. Let's just scroll the images and see. Right here, I'm going to scroll the images and see what we can do about this. So, yep, scrolling from up to down and from down to up. Now I'm going to scroll once again, slower, so you guys can see, and leave in the comments below what do you guys think this patient has that is painful enough to have a CT scan ordered for evaluation. So right there, see, left arm, right arm, a bunch of artifacts, both from moving and from the malpositioning, with the arms down and with metallic objects on the field of view, in the field of view. So we have scrolled it. So let's see what we can tell about these images. So this is the right side of the upper abdomen. This is the liver. Liver seems absolutely fine. We have a gallbladder right here, which is half empty, half full. We have a gastric chamber filled up with food. This is quite normal, quite common in emergency setting patients. The spleen looks normal. Remember, we need contrast enhancement in trauma patients in order to properly tell if the parenchymatous organs of the abdomen are sane, are fine, or what, because we can have completely hidden lacerations on a pre-contrast phase and very easily apparent lacerations as soon as we get a contrast enhancement phase. So we can't really tell much about this kind of lesions in this case because we have no contrast enhancement. So moving on, the pancreas looks fine as much as we can tell. Right here, head, neck, body and tail. Right here you can see the left adrenal gland and the right adrenal gland. The portal vein looks fine. There is no biliary tree dilatations, not that I can tell for sure because we have no contrast enhancement. and no dilatation. Oh, the bowel, colon seems fine. Rectum, you have a enlarged prostate because this is a 61-year-old patient. I can't tell if there is any fracture of the hip. It seems fine, and you can tell as much as I can that there is some degenerative disease of the lumbar spine, which is perfectly normal at this age. Let's just go for a sagittal view. And yep, no fractures of the spine, just a regular old man's vertebral spine, as we see every day, every time we get this kind of exams. So the left kidney looks fine, no dilatation. It seems there is some kind of dilatation, but the calyx are fine, no signs of stones, and the ureter looks fine. And yep, and I know you guys are screaming on your chairs. Speaking of this calcified aorta is calcified a bit more than expected for his age, but what can you do? Everyone ages differently, and we can see right here there is the appendix right there on the right iliac fossa, as most of times it is. So we have accomplished yet another task of localizing the appendix. So what could be the cause of this patient complaining about abdominal pain? So I know you guys have seen it, you guys are complaining. I can't hear you guys, but I can feel you guys are screaming at your screen saying look at the right kidney. And yes, the right kidney seems extremely bad right here. This isn't good, not at all. This is a very serious disease right here. Right kidney is all over the place. There is thinning of the parenchyma and a diffuse massive dilatation of the calyx all over the place in the pelvis and the proximal ureter, until we reach this major calcification inside the ureter. This is a stone, but as you guys see right here, the fat, pararenal fat, isn't densified, it shows no signs of straining, which tells me that this isn't a very acute disease. This is probably a chronic disease that is painful in a long time, has been bothering this patient for a long time, mostly because this kidney has a very severe chronic parenchymatous disease. It's losing its substance, its parenchyma, its function, thickening the parenchyma due to the chronic obstructive disease. And we can readily measure this stone. It's almost more than 50 centimeters, 15 centimeters to approximately to the entrance of the urinary bladder. And this stone measures, let me just zoom in so you guys can see better. It measures 1.9, 1.8 centimeters by 11 millimeters by 1.1 centimeters, and we could measure its attenuation right here. Usually these stones are very hyper attenuating. This is a 1500 Hounsfield unit. This is extremely dense, extremely hard to break, probably calcium oxalate as always, and it is causing a major kidney disease. Probably the function of this kidney is greatly reduced. It's almost a non-functioning organ, unfortunately. And this is, of course, a fine justification, a fine motive for this patient to complain about right-sided abdominal pain. This is in stones. These are phlebolytes. These are calcifications of veins, small veins on the pelvis. And this patient has abdominal pain because of this urinary stone right here, and he has a major disease of the right kidney. So I hope you guys have liked this video. If you want to watch yet another video quite like this one, just click here and keep watching. Hit that like button and consider subscribing to the channel, and I'll see you in the next video. So long.